only taking the time to reflect on the importance of one's physical health leaves out an important corresponding part of health, that is emotional health and happiness. One of the things that we're all most likely to deal with, in addition to stress, which of course I've talked about in a previous video, is anxiety. And anxiety is the emotional response to something being uncertain, in which the outcome could possibly be negative. And of course, anxiety is going to come from our obsessing about that uncertain thing and the possible negative outcome. Now, there is plain old anxiety that we might experience every so often if there's something we can't quite count on, or if there's something negative that we've never experienced before. And as a result, we don't know how to process in any different way. But there are also much more serious forms of anxiety. And these include things like generalized anxiety disorder, obsessive compulsive disorder, panic disorder, PTSD, or social phobia. Of all of these things, the key thing to think about is whether the anxiety that we are experiencing is actually getting in the way of our ability to live the lives that we want to lead. And it is exactly this question that would help us to understand whether or not the anxiety that we're experiencing has become something greater than that day to day version of it. If this is the case, really a mental health professional needs to be sought out. Anxiety, again, is something relatively common, but it can also be completely paralyzing. And we owe it to ourselves to get whatever help is necessary to keep that from happening. Along with anxiety comes loneliness, and in a life that can feel very new and very different, and which can, as a result, make it difficult for us to interact with people that we might have known our entire lives beforehand, loneliness is something worth considering. Usually it will pass, but if not, we want to be very careful because it can lead to things like anxiety, the other serious forms of anxiety that I've just mentioned, and also depression. Speaking of depression, and it is here that you'll want to refer to page 385 or document page 393 of your textbook. There's an important difference here between depression versus being depressed. Being depressed is the sort of thing that happens after things happen in our lives that don't go our way. Excuse me. Now, that is a negative emotion, certainly, but generally this will pass. That's in opposition to depression, as in what can be the disorder that is one of the very common mental illnesses right now. Depression, as the mental illness, is a down feeling, something that represents a kind of a negative influence on how we interact with everything that we experience in life. If that form of depression is something that we're experiencing, then generally it would last for much longer than momentary depression. Generally we're looking at 2 to 3 weeks. And the question that we have to ask ourselves is this overall feeling of depression having other negative effects on emotions, lack thereof, our ability to understand and interact with others, our self image, and really even our understanding of the entire world? Depression can sometimes lead to feelings of emptiness in which we feel cut off from that world around us and unable to understand what other people are doing, how they feel, and how they think. To that end, and a part of me feels bad even acknowledging it, but it's an important thing. Sometimes feelings of anxiety, loneliness, and depression can lead to the serious consideration of suicide. If this is ever anything that crosses one's mind for any period of time, the National Suicide Prevention Lifeline is out there, and they exist specifically to help anyone who ever seriously considers suicide to talk through, process, and understand that it's not worth it. It's never worth it. You've got their phone number here. That's 1 800 273 8255. Now, when one thinks about emotional health, there are some important factors to realize, one of which is that most emotions can't really be controlled. We can control our ways of acting on those emotions. We can control our understanding of them. We can even control our moods, which result from those emotions. But again, we don't want to be under the impression that we can control the emotions themselves. It's what we do with them. To that end, there are some good strategies for ways of dealing with or reacting to our emotions, and that includes connecting with others, developing empathy, in other words, developing our abilities to put ourselves in someone else's shoes and figure out what they must be feeling and what they must be reacting to. We want to practice honesty always with ourselves and with others. We want to remember that negative emotions are temporary. They will pass, assuming that we have ways of processing the result, or pardon me, the sources of them. And finally, we want to remember that things will get better eventually, even if it seems like it might take a long time.